We'll go ahead and call the meeting to order. So, does anyone move to approve the meetings from March 3rd, minutes from that meeting?
I'll make that motion.
I'll second.
Thank you. Okay. All right, great. So then we are going to move to item number 2, public input, public comments and discussion. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda item as on which action will be taken. Public commentary will be limited to 3 minutes per person. Is there any comment? Okay, I will take that as no. So moving on to item number 3, COVID-19 status update in our county. So we've had a quiet 2 to 3 weeks, thankfully. Our numbers had been holding steady at 943 total cases for the county. We unfortunately have 1 presumptive positive today that's pending confirmation. Still at 20 deaths, but overall much better than it's been. Disease investigation and contact tracing continues on as it has been doing, and testing definitely has slowed down. We do have the ID Now rapid test in the hospital now, and we've been utilizing those, as well as still sending some out to the state lab for confirmation and surveillance monitoring for genotype. We haven't been sending out a bunch of those, but I'm hoping to start doing that a little bit more on a random basis. And if we have positive cases, trying to encourage providers to order that for genomic testing, just so we can see what variants we have here, if any. Vaccinations are going well, from what I understand. We have another event coming up from FEMA. They are coming to April 16th, Friday, from 9 to 4 at the Senior Center. So I'll have Marcia talk about other vaccination stuff that's going on at the health nurse office, if she's available, or Cheryl, anybody?
This is Marcia. So I'm in and out because I am giving vaccines today, of course. So we're clicking right along. So we gave close to 300 first doses on the 27th of March. And so on the 24th, we should be able to do those other 300, hopefully. So we'll get those vaccinated. Like the mobile vaccine unit will be here the 16th with Johnson & Johnson, or the Janssen. And we are in our clinic doing about 50 a day every Wednesday. And we're doing the combo between the Moderna and the Janssen. If there's any questions.
I don't have any questions. Great, thank you so much for all your hard work. We are also going to be starting more regular immunizations in the clinic. So we have a date scheduled for next Thursday to be giving, I think we're almost up to the 20 people now that we needed. We're trying to do 10-minute increments, or sorry, 10 people increments, and we had 17 as of this morning. I think we're working on getting the 3 more to make sure that it's the 20, or we'll have to defer them until the next week. So we are going to be a little bit limited on staff the week after next, but we plan on doing 1 to 2 days a week after that in the clinic. Right now, we only have Moderna for the clinic, but I'm hoping once we get more Janssen available that we'll be able to talk to Marcia and Cheryl about getting some of those to keep on hand for clinic and vaccination as well. So more to come on that, hopefully, but moving along in the right direction, thankfully. Mitigation efforts, we're all still trying to encourage mask wearing and continued social distancing and avoiding large groups. So I don't think there's really anything new there. I don't know if Tyson is on, if he wants to talk about anything in this regard, or if Sean wants to talk about it.
Just on the vaccine, so I think there's a couple outstanding things we need to take care of. One is probably something with mines. So I've been working with Rich Wagner and we're still trying to formulate the best way to do that. So that's something that will happen hopefully relatively near future. And then I've been getting a couple of requests from folks in the outlying communities. And I would need to talk to Marcia about what's the best way. Most of them in Grass Valley. Talk to Marcia about what's the best way to handle those. I don't expect it's going to be very large numbers at all, but they are asking the question. We probably will have some bounds as well, but I think we should probably
How would you propose trying to get that data?
if they're not homebound, I'd like to think that still think about it. I think they're doing the shopping and everything there anyway. So I think that's probably the primary avenue. If they're homebound, then probably we just need to get our heads together and find out. Make the survey and go out and not those people out.
Yeah, I don't have a problem with that. We just need to find out the numbers and where they are and map out a route. That'd be fine. Can you let me know if you get that information? And Marcia or Cheryl, do you have any information from anyone who's been calling you for that as well? Still there. Yeah, so definitely keep me posted on that. Okay, and I know that our the clinic today, we posted these vaccine flyers for the Janssen from FEMA. And some of the folks at the clinic have been trying to network that information out, and maybe some of the mine folks will come to that. I don't know.
They have been specifically advised of that.
Okay.
So they are aware that that's an option.
Okay.
Again, I think it has more to do with the non-interference of production.
Yep. Yep. So there's a way maybe we could coordinate a event out at the mine. Is that?
Yeah, I think if that was the desire of mine.
And you're in communication with Rich already about that?
Yes.
Okay, so just keep me posted. The other one is EP, I think is the other big one, or?
I'm not talking to anyone DP. I can't. The other one is for the can.
And Relief Canyon,
Okay.
Relief Canyon also.
I haven't talked to them.
Okay. All right.
They know how many people are working on the can? Is that?
I think there's maybe 100 plus.
That will be a definite task to move on next for sure. Okay, any other questions regarding item number 3? Comment?
I'm sorry, I missed what you said about it. Have we had any cases in the last couple weeks?
So we have one today that's pending confirmation. So we have a suspected.
It just, so we're doing really well.
Yes,
Sounds like.
we've had 3 to almost 4 weeks of no new cases until today.
That's terrific.
Yeah.
And bad.
I know, bummer for that case, but good for the overall picture for sure. So just on that note, there are more outbreaks cropping up around the country with new variants in younger populations. So just please encourage the young, healthy folks to consider vaccines. If you hear anyone asking, we definitely do encourage it. And people who have had COVID and have long haul symptoms, they have been seeing in about 35% of people they're following that they actually are getting better from their long haul symptoms after the second dose of vaccine. So that's promising as well. Interesting, but promising. Okay, there is nothing else. We're going to move on to item number 4, to Pershing County's transition recovery plan. That's required for each county to move forward to a hopeful transition back to our full governance for our county. So Carol, did you want to?
to everyone, on Sean's email list and to the health board, we sent out the recovery plan and Sean made some edits to it and did a great job. And then I also have a statement from the school district on what they're doing, and also from the hospital. So this has to be submitted to the task force by April 15th. So I have a cover letter that needs to be signed by all the commissioners, Dr. Van Gilder and Sean yourself. And I think we're gonna have to sign this one because I can't bring it up on my phone and we'll maybe copy it on the letterhead or something. But if we could do that, then we can get it in and then we'll see what they say. But I think that we're well meeting whatever requirements that they have, for that. So what we need is just formal action on it.
Okay,
So
so,
did the DA review the language?
I don't know that he did. I mean, there's nothing wrong with the language. It's just answering their questions. We can have him review it.
I was just curious what his take was.
Yeah, he's not on the distribution list, is he? I don't think.
I don't know.
Yeah, I can have him review it just to be, but we didn't say anything that is controversial or anything, so.
okay, do we need to wait until he reviews that or can we?
Well, we can do it pending, we can approve it pending his review and okay, and then I'll get it up to him.
Okay.
Today, so I would make that motion that we approve it.
I'll second.
Perfect. Okay, excellent. Thank you so much for all your hard work. Oh, yes, let's vote.
Aye.
All those in favor?
Aye.
Aye. Any opposed? No. Okay, so pending approval. from-
Yeah, and I'll get it up to him later today, just for him to look at.
Thank you.
Sean, do you want to just go ahead and sign this since you're here? Do that, there's a line here for you. And then maybe give it to Larry for him to sign. Thank you. Do you want it? Well,
Okay, so anyone else with questions regarding that?
you want to sign there for you. Get Sheila to sign.
Yes, thank you.
Lacey? Nope. Yep.
Here,
Lacey.
oh, yeah, Lacey. Thank you.
Okay, so then moving on to item number 5, reopening of the swimming pool and scheduling competitions. Do we have a guideline from them yet?
No, I just asked that to be put on there. I was hoping that we would. They're wanting to get the pool open as soon as possible and they're wanting to do the competitions. But I don't know, what guidelines they would need to follow
So
in order to do that. The pool's going to be a while
Yeah.
still. So, with the board meeting again in another month, that we could ask Pat Rowe to bring something forward.
okay, perfect.
There
Yeah,
are some
there's-
specific state guidelines
Yeah.
that deal specifically with sports. Some things were approved, football was, and Carol and I sat through a very unfortunate meeting with the state about 2 hours worth of water polo
Oh, gosh.
discussion. Didn't realize water
Pub-
polo was a thing.
Public comment, water polo,
Yes.
yes.
Yeah,
The whole time.
that was not approved. I don't know what the means of it, but there are some sports have been approved, some other sports have not. And so I think, whatever guidance, kind of keep with language in our memo,
Mhm.
we would kind of follow whatever guidance was, out there recommended. We would encourage people to do that.
Well, I think we could look to the NIAA to see what they are doing in regards to high school sports. Because I know that the swimming, there's gotta be swim teams around the state. And see from there, go from there.
But I can ask Pat Rowe to come
Okay,
to the next
perfect.
meeting and,
That'd be great.
yeah,
Yeah, I heard that they're doing some repair on the pool.
yes,
So,
yes, hopefully. It's been a long process,
okay.
but, and not, yeah,
And not very cheap.
Oh, no, yeah, for sure. Okay, so we'll continue that on for next meeting and you'll talk to Pat Rowe about that.
Okay.
That'll be great. Okay. So moving on to number 6, reopening of the Pershing County Library, discussion and for possible action.
and Kathy, why don't you come on up? And I need to offer an apology to the library director and the library board and my zealous for wanting to get the library open. I think I've crushed a few souls along the way. And I do apologize for that. And I know that the board and the library director are doing everything they can. My main thing with putting this on here wasn't so much that we would approve something different than what you have, but getting an update. So if we could get an update on what's happening in the library.
Well, right now, we're following Dr. Van Gilder's recommendations. She advised that we keep the door locked, or agreed that we should, so we could monitor, for the right word, we can keep an eye on who's coming in, make sure that they have a mask on, and and that they know the rules. And so we've been doing that. We put hand sanitizer on every table. We put signs about wearing a mask around, and the rules are posted around the building. And seems like there was something else, can't remember. But anyway, so we've been doing everything that you told us to do, and then we're wiping down surfaces. We're having patrons use the self-checkout machine. The problem with when we help somebody, we're right there, we can't maintain that 3 feet. So, a lot of people come in and they have never used the self-check before. So we have to go over and show them. And I mean, it's easy. Once they know how to do it, they can do it themselves after that. But anyway, so there's those kind of things. Same with the computers. We've moved everything so it's 6 feet apart. And which means we can only have 2 computers available. And it's almost impossible to help somebody on a computer without, reaching around and then pointing or, so, but we're doing the best we can. I think we could probably open pretty soon, right? I mean, we are open, the door is just locked. But I think I think we should be able to open pretty soon, as long as you're okay with that.
Yeah, I think as long as the continued policies are in place, unlocking the door and keeping that open is definitely fine, as long as you're not having the issues with people coming in and not following the
Right.
guidelines.
Right.
So it's gonna be kind of up to you guys to see what that demand is and how many folks are coming in.
Okay.
So
This,
what's your capacity? What's half capacity for the library right now?
well, Dr. Van Gilder advised 10 to 15 people.
There's not a lot of space in between all the books, unfortunately.
Yeah.
So I think at this point, you're just gonna have to see how many people come in, and
Right.
as things are relaxed a little bit more, then hopefully that maybe you've set up tables that are a little bit more spaced. There are only a couple areas for seating.
Right.
Right.
And like 1 chair at a table, maybe 2 at some of the bigger ones. So, there's no group places unless kids come in and sit on the floor, which they do sometimes. But, so I think it kind of will depend on where people are in the building. We've had times where it usually happens after school or maybe on a Friday, where parents are bringing in their kids and they're kind of all grouped around the desk. And, but it doesn't happen very often, and we can ask people, especially now, for them to step back and, be more aware of where they are compared to other people. So, I think we'll just kind of have to play it by ear.
What's the max number you think you've seen in the library at one time in the past?
Well, we've had over 100 in there for some of the activities that we've done. But, geez, max number, it's hard to know because they're always spread out. Yeah, I mean, in clusters, but it's not unheard of to have 30 people in there at a time. We'll have some kids, against the wall around the corner, and there will be people reading the magazines, and we'll have somebody down at the end doing tutoring, children, and then we'll have a bunch of kids gathered around the computers in the front, and kids with people with their children looking for books. It really varies. We'll be just like so slow for a while, and then all of a sudden we get, influx of people. So
It's going to be kind of hard. I mean, I think with the different types of folks that you have in there, because if a family comes in and they're all together, of course, they can be closer than 6 feet apart
right.
because they're family. But so, yeah, just kind of keep an eye on things and we'll
Yeah.
continue to slowly open up. Mhm.
You have the signage saying that a mask is required, right?
Yeah,
And if you're basically at your maximum capacity, you do have the ability to ask somebody to wait outside if you're at maximum capacity, or ask them to leave if they're not wearing a mask. And I am always within 3 feet of anybody because that's my job. And I wear a mask, and I don't have any issues with it. But to say that the library is open, but the doors are locked, that doesn't necessarily tell the public the library is open.
all I can tell you is these were the things that libraries across the country have done.
But now they're all opening again.
They are slowly, and it depends on each community.
And with the count that we've had in this community the last 4 weeks, other than today, I would say it's safe to unlock those doors. And if you have to ask somebody to wait outside until somebody leaves,
You're,
that's the way it's got to be.
Sheila, I did just say that we could probably open. But, I'm pretty sure that we could unlock the doors. So, we would be doing that in next, well, maybe tomorrow.
It would be great during spring break for kids.
We haven't had any kids come in for a while. It'll be interesting to see how long it takes them to rediscover the library. A lot of them, especially on a Friday, will come in. They'll call their friends and say, "Come to the library." And then we've got kids playing hide and seek, and all kinds of
But
stuff.
the library isn't a babysitting place. It's a place to come in and use the computers or check out a book. So if they're not acting appropriately there, then they should be asked to leave. That's what we have a park for.
Yeah.
Yeah, you can't send them to the park when it's really cold or 110 degrees. So
Fresh air is good for them.
As long as they have appropriate clothing. Only if they have appropriate clothing though.
Right.
So lots of challenges. So you'll be talking to the board about opening.
yes, yes, we will.
Okay, so there's nothing that we need to
No,
do.
no,
just as an
it's the
update.
board that
Yeah.
makes that action.
Perfect.
Thank you.
Thanks, Kathy. Okay, so for item number 7, are there any folks from the school district or any other business folks that would like to talk about updates in the community? We have is Russell Fecht on, or
Russell is not on. What's earlier this morning?
Hmm. Okay.
Nobody is.
Okay, perfect. All right, so schools have been continuing to function at their usual. We've had, as in the community, we haven't had any specific cases or clusters in the school for the COVID, so that's lovely. The football teams have been playing. They're testing once a week, Thursdays before their game on Fridays. They've been doing really well with that. Not heard of any other businesses or community members with specific needs or questions. So I don't know, you are a business owner, so I don't know any concerns or issues. No, great.
Yeah, things are going good. People are, I have clients coming in that I haven't seen in almost a year because of the vaccinations and the count being down. So it's promising.
Yes. Trying to get back to normal.
Yeah.
Almost there. All right, so update number 8, updating regarding Board of Health dissemination of information. So continue to just try to, get information out as best we can. Thank you, Justin, for getting everything updated on the website. We appreciate it. The hospital does update also on Facebook page, and Wendy at the Frontier Community Coalition continues to update things too for us. I had her update the vaccine flyers for the FEMA event as well. Is there any other suggestion for how we can continue to try to get information out to folks?
Well, Sheriff was going to put up his message boards again. Most of the my clients and people I've talked to that didn't know before have all been vaccinated, so they're thrilled. The ones that I could tell that needed them, I did call. The message boards have really helped with the last one.
Great. Excellent.
What can we do for the people out in Emily and Rye Patch and Grass Valley is close to Winnemucca, but are they getting the word? And I don't know if they're coming in and getting the immunization or not.
Yeah. I don't know about it when you're right now.
Yeah.
I can call some people and see if they have any better feel for it.
If they can post some
Oh, I know
flyers.
I have several clients from the Bycatch area, and they did hear about the vaccination pods we have, and a lot of those clients came in and got vaccinated. I don't know about Emily, and maybe we should try and do a pod out there for the residents that needed it, or if they want it, unless they're going to.
This is Marcia. And I'm sorry, I missed part of it because I was given a vaccine. So between Winnemucca and Lovelock, we have a lot of people who have out in the Grass Valley area, in the Imlay area, Unionville, all that area, they have been coming to one or the other.
Oh, good.
Oh,
Okay.
Both know that they are welcome to come to either or, whichever time, date, and place works best for them.
Great. Thank you, Marcia.
At our last shop at the community center, we had several residents from Inley as well as Rye Patch. So they are getting to work.
Good.
I think that this FEMA trailer on the 16th will be pretty telling. So we had 700 doses available at the last one, last Saturday pod on the 24th, 7th, whatever day. We shot less than 300. So I suspect we may be approaching saturation point with uptake. And I hear anecdotally that people are waiting for the Johnson one-shot version. So I guess we'll find out. But I just think it's interesting. I don't think we've exceeded the 25% mark of county population. And I just think that desire to receive the vaccine is relatively low in this county.
Well, I am waiting for the one shot because I don't like shots.
One shot better than no shots, so that's definitely
So
fine.
when that's available, I'll go get mine.
Yeah, and a lot of people express concern, the vaccines work differently, right? The one, the Johnson & Johnson version has a completely different mechanism of action than either the Moderna or the Pfizer. So I know a lot of people were waiting on, it's a more traditional style of vaccine, less effective perhaps, but a more traditional way of approaching the problem. So it'll be interesting to see how many, we get the word out as effectively as we can. It'll be interesting to see. How many people actually take it.
Well, and then my husband has his medical care through the VA. And the VA is now starting to vaccinate veterans and their family members. So instead of us going all the way to the VA, I'd rather have it done here.
And also at the clinic here in in Lovelock, I'm sorry, we are doing every Wednesday a combo of both Moderna and Janssen. So we
Yes.
do both vaccines here.
Marcia, how many did you get today?
We are doing, sorry, I had to look. Okay, so it's 20 Janssen and 30 Moderna. And we're averaging between 40 and 50, depending on how many regular patients I have also.
How many Janssen vaccines do you guys have now? Do you know? Did you get another shipment of those?
We do, we have 200. And
Excellent.
I just transferred 100 doses of Moderna to the hospital, to Cindy at the hospital, so
Great.
that we can keep the hospital supplied and going also. So hopefully between the two, and we have appointments clear out until the end of April. So people are still calling for appointments and stuff. So I don't know, we hear a whole lot about people wanting, personal service instead of the whole pod type thing, but it's a shot. It's not personal service. I mean, I'm sorry, but you're asking the same question at a pod, at the mobile vaccine unit, as you are at our clinics. So you're not taking a life history, you're not doing all of that. So we need to get people past that and just to get them the first available chance they have to get the vaccine they want.
Thank you. All right. Anybody else have anything to add on that item? All right, number 9, announcements, future meetings and agenda items. So I don't think anyone else has any other announcements. Anybody? Future meeting dates are already set for May and June, correct?
May 5th is the next one.
And any other agenda items anyone can think of right now that they would like to put on for next meeting?
Just the reopening of the pool. And
That'll continue to be
and
on.
I'll ask her to come.
We will keep that on for sure. Okay. And then we'll move on to item number 10, public comments. And does anybody have any comments they would like to bring forward? No. Okay. So moving on to number 11, we will move to adjourn the meeting. Thank you, everyone. Alright. So Sean, you will get me posted.